السلام عليكم. نكمل موضوعنا مع البروتوزوال انفكشن. في الجزء السابق أخذنا في الانترودكشن حول البروتوزوال مايكرو البروتوزوا infection causative agents. In this lecture we are talking about antiprotozoal drug. For the antiprotozoal drug we have anti-amoebiasis drug. These drugs are useful for treatment of infection caused by Entamoeba histolytica. This infection may cause acute or chronic infection. In the past lecture, we talk about Entamoeba histolytica classification and the pathogenicity of these microorganisms. Also, the infection show a different degree of illness from no symptoms to mild diarrhea to fulminant and severe dysentery. The diagnosis is done by isolation of the Entamoeba histolytica from fresh stool. هنا الانفكشن ممكن تكون acute أو chronic والsymptoms ممكن تكون mild أو severe diarrhea والdiagnosis عن طريق إنه isolation of the microorganism in the stool, in the fresh stool. بالنسبة للpathogenicity أو life cycle of this organism, we have excitation to give the trophozoite, which is the active form of the Entamoeba histolytica, then multiply to give more trophozoites, which is also an active form, or give a new cyst. Then the cyst exists from the body getting a new, from the host body, go to infect a new host body, and so on. The diagnosis is done by detection of the troph or cyst inside the human body. Classification of Entamoeba, we have a tissue amoebiasis or extra-intestinal amoebiasis. For the treatment of tissue amoebiasis, which is we have a tissue amoebiasis or extra-intestinal amoebiasis. For tissue amoebiasis, for both intestinal and extra-intestinal amoebiasis, we can use nitroimidazole or alkaloids such as imidine or dihydroimidine. For the extra-intestinal amoebiasis, the only drug used is chloroquine. For the luminal amoebiasis, we have the diloxanide, nitazoxanide, and quinaclone and dihydroxyquine. Also, we have an antibiotic such as tetracycline and paromomycin. So, as a simplification, we get this note. Tissue amoebiasis, class of metronidazole, and extra-intestinal amoebiasis, we have chloroquine and luminal amoebiasis. This is the classification of the slides. Luminal amoebiasis. We have mixed amoebiasis, luminal system. We give tinidazole and metronidazole. We have only luminal amoebiasis. We give paromomycin. For the formation of the troph, we have certain antibiotic, which is diloxanide, and so on. We have a systemic amoebiasis, chloroquine, dihydrochloroquine, dihydroimidine, and imidine. This is for systemic, this is for mixed, and this is for luminal amoebiasis. The drug used for treatment of amoebiasis is metronidazole. It is a prototype of nitroimidazole having a broad spectrum of cycle activity against developing trichomoniasis, Giardia lambelia, and Entomobacter histolytica. This is the most common pathogen that the metronidazole act. Also, we have blastocytosis, Parantidium, spirochetes, and aerobic streptococci. Also, we have activity against many gram-positive, anti-gram-negative, anaerobic bacteria. The mechanism of action of metronidazole, it interferes electron transport, disturb energy metabolism. Also, it inhibits nucleic acid synthesis by binding to the DNA, disturb the helical structure, and result in cell death. This is the metronidazole. Metronidazole gets inside the body, converted to metabolite, which prevent the reduction of ferrodixine to ferrodixine oxidase, which is the electrons transport, and so lead to DNA fragmentation and cellular death. The indication is as syllabus, the indication of metronidazole for treatment of giardiasis, amoebiasis, trichomoniasis, ulcerative gingivitis, Helicobacter pylori, and so it is used in combination with the treatment of the gastric and peptic ulcer. The side effects include oral moniliasis, metallic taste, nausea, vomiting, anorexia. For the contraindication, it is contraindicated in a neurological disease, blood dyscariasis, and first trimester of pregnancy should be used with caution, and some references get the note it is not preferred to be used. Also, for chronic alcoholism, it's contraindicated or used with certain cautions. This is for the metronidazole. Let's get another one, which is tinidazole, which is famous as Vasagine. It is similar to metronidazole, but it has long duration of action, better effectiveness, and fewer side effects of metronidazole. It indicated for the treatment of amoebiasis, trichomoniasis, and giardiasis. Also, it's used for eradication of H. pylori in combination with other antibiotics. Here we have another one which is called diloxanide furoate, which is effective in treatment of luminal amoebiasis, that trophozoite responsible for the production of cyst. This drug have direct amoebicidal action, destroy the amoeba before the production of cyst, which is the trophozoite, and thus kill the parasite. It is indicated for treatment asymptomatic cyst passer, and it is used for treatment of intestinal amoebicide. It's given in combination with metronidazole in the treatment of invasive amoebiasis. ممكن إنه يعطى مع الميترونيدازول for treatment of recurrent of or invasive amoebiasis. بالنسبة للcontraindication, contraindicated patient with hypersensitivity and GI side effect should be considered. For the ornidazole, which has longer duration of action than metronidazole, and used for treatment of chronic amoebiasis and asymptomatic cyst passer. So it's used for treatment of cyst passer. The side effect is similar to tinidazole. Cinidazole is a conjure of metronidazole, have the same spectrum, and used for treatment of giardiasis, trichomoniasis, and non-specific bacterial vaginosis. Side effect is similar to metronidazole. بالنسبة للسينيدازول شابه للمترونيدازول والتريتمنت يستخدم في علاج الانتستينال أميبياسيس، كاردياسيس، ترايكومونياسيس ونون سبيسيفيك فاجينوسيس. الديوريشن مالته يكون long duration of action compared to metronidazole. بالنسبة للإميتين ودايهيدرو أميتين هي الكالويد من السيفاليس إبيكاكونا potent direct acting amibicide the trophocyte does not kill the cyst, inhibit protein synthesis, cannot be given orally. The toxicity one of the side effect اللي هي pain, irritation, eczematous lesion at site of injection, nausea, vomiting, abdominal cramps, hypotension, tachycardia, ECG. Contraindicated بما إنه تسوي ECG changes and myocarditis, so it's contraindicated in the presence of cardiac, renal disease or during pregnancy. Reserved in the treatment of extra-intestinal amoebiasis and intestinal amoebiasis. Patient not responding to metronidazole or cannot tolerate metronidazole, we can give the emmetine and dihydroemmetine. Luminal amibicide follows emmetine to eradicate cyst, also effective in liver flux infestation. Dihydroemmetine is also effective but less toxic and is preferred over emmetine. Emmetine and dihydroemmetine. Chloroquine. Let's get another one, which is chloroquine. Chloroquine accumulated in acidic vesicle of amoeba raise the vesicular pH were interfered with the degradation of hemoglobin by the parasitic lysozyme. Use amoebiasis and giardiasis, chloroquine. Side effect epigastric pain, loss of vision due to retinal damage, loss of hearing and mental disturbances. Loss of hearing and loss of vision, which is occurred with the long-term use. Its uses as for treatment of amoebiasis, giardiasis, also its use as anti-malarial and anti-inflammatory for treatment of many autoimmune anti-inflammatory disease, such as treatment of the rheumatoid arthritis, treatment of ulcerative colitis, and other diseases. 8-hydroxyquinolone, active against entamoeba, kill cyst-forming trophocyte in the intestine, eradicate cyst from asymptomatic carrier. The this uses for giardiasis, trichomoniasis, non-specific diarrhea, and fungal and bacterial infection. The adverse effect, which include subacute myelooptic neuropathy, goiter, and transient loose and green stool. Because of this side effect is not preferred to be used nowadays. For the tetracycline, it's inhibit amoeba at high concentration. Although tetracycline is incompletely absorbed in the intestine, so it's reached the colon, inhibits bacterial flora along with the antimoeba histolytica which lived symbiotically. فالclassic tetracycline not absorbed completely, reaching the colon, inhibit the bacterial flora. Its use as adjuvant in the chronic difficult to treat cases. And tetracycline lessen risk of opportunistic infection, perforation of peritonitis when given along with the systemic amoebiasis, not good for acute dysentery and for hepatic amoebiasis. Aromamycin, it is aminoglycoside, given only against intestinal or luminal form of entamoeba histolytica. Its direct acting amoebicidal bind to 30S ribosome, interfere with the protein synthesis, and this is stable for the treatment of acute amoebic dysentery and the alternative treatment. For the luminal amoebiasis, diloxanide is alternative or tetracycline. For the mild amoebiasis or asymptomatic cyst passer, metronidazole, tinidazole, or luminal plus luminal amoebiasis as above اللي هو نفس التريتمنت diloxanide. نان الكورس من التريتمنت إنه metronidazole يعطى لمدة 7 days أو 2 grams daily for 3 days وتينيدازول 600 ملغ daily for 7 days or 2 grams single dose. Nitazoxanide 500 milligrams twice daily for 3 days وquinaclor 250 milligram 4 times daily for 7 days, and this is also the treatment of trichomoniasis. Also we have clotrimazole for 6 every night for 6 to 12 days. We have povidone abiodine also for treatment of trichomoniasis. But for drug given orally, we have metronidazole, tinidazole, cinidazole. Clotrimazole is another drug, but it's also effective for treatment of trichomoniasis. Here we get a new line, which is treatment of leishmaniasis. Till this slide, we finish the antiprotozoal. For the treatment of leishmaniasis, we have visceral leishmaniasis, we have mucocutaneous leishmaniasis, we have cutaneous or dermal leishmaniasis. A drug used, which is sodium stiboglycinate or bentamide. This is drug used for treatment of leishmania. At this point, we finish the antiprotozoal drugs in some details. Also, we have many other details we don't discuss, but this is the basic notes we should know. إلى هنا انتهت محاضرتنا. أرجو أن تنال إعجاب حضراتكم. شكرا جزيلا.